through the roof. The deductibles will go even higher. The co-pays will go even higher. The out-of-pocket costs will go even higher. And the bottom line is Americans between the ages of 50 and 64 will pay an age tax and be forced to pay premiums 5 times higher than what younger people pay for their coverage. I've heard my colleagues on the other side say, well, that's only fair. Well, I don't think it's fair that seniors should have to pay a lot more, that those between 50 and 64 should have to pay a lot more. But also, Trump Care leaves the sickest and vulnerable Americans at the mercy of insurance companies, allowing them to charge a 30% penalty or sick tax. I don't think that's very fair. And last night, in order to garner votes from the extreme right and their party, House Republicans added a provision that eliminates protections for essential health benefits. Now, maybe people don't understand that, but let me explain it. The ACA ensured that when a consumer purchased health insurance on the individual market or gained coverage through Medicaid expansion, that their plan would cover 10 critical essential benefits. Trump Care eliminates this guarantee, meaning that unscrupulous insurance companies can sell skeletal plans, junk insurance, without benefits for hospitalization, maternity care, mental health, drug treatment services, and Americans won't even know what they're getting. They won't realize that they have worthless insurance until they get sick and it's too late. The bottom line is this bill should be defeated for so many reasons, because so many more people will not have health insurance, because their costs are going to go up, and because they won't even know what insurance they're buying. We're going to go back to the old days of the Wild West when insurance companies could sell whatever junk insurance they want, and the public won't even know what they're getting. It's a disaster for the American people. I urge my colleagues to vote no.
Gentleman reserves the balance of his time. Gentleman from Oregon.
I yield myself 20 seconds. The irony of that argument is it was just a year or so ago that every member of this House who was here at the time and the Senate by unanimous vote agreed to waive the essential benefits he just listed off for the employment market between 51 and 100. And by the way, those essential benefits don't apply to the large group market. So this has already been done. I now yield a minute and a half to the gentleman from Texas, the vice chairman of the full committee, Mr. Barton.
Gentleman's recognized for a minute and a half.
Mr. Speaker, I ask unanimous consent to revise and extend
Without objection.
Thank you. Mr. Speaker, I supported this bill when it came out of the Energy and Commerce Committee 2 or 3 weeks ago. I want to thank Chairman Walden for his excellent leadership. As he knows, I had some concerns about the bill at the time. I didn't think it addressed all the problems that we needed to address. And so at the start of this week, I was a no vote, a friendly no vote, but I was a no vote. But our Republican leadership in the House and the President and his senior advisors continued to involve themselves in constructive discussions with people like myself. And 2 days ago, they agreed to, or yesterday, agreed to put back in the repeal of the essential health benefits provision. And that is a big win for conservative values. So I am now a yes vote. My friends on the left seem to think the only way to get a benefit is to have the federal government mandate it and then have the federal government pay for it. I'm here to tell you, Mr. Speaker, that markets work. If we create a health care market where people can choose their insurance that fits their needs, there will be plans that provide for every so-called essential health benefit, but there will also be plans that provide for specific markets of young people without children or elderly couples or whatever it is. Mr. Speaker, markets work, and you don't have to mandate benefits for those markets to work.
Gentleman's time has expired. Gentleman.
Could I have 15 seconds?
Yeah, I yield the gentleman 15 additional seconds.
Gentleman's recognized.
Oh, I'm sorry. I didn't know I was recognized. Mr. Speaker, we always want to score a touchdown. Sometimes we take a field goal. What we don't want to do today is take a safety. Vote for this bill. Let's send it to the other body and continue to work to improve it. It's a good bill. Please vote yes.
Gentleman from New Jersey.
Mr. Speaker, remind my colleague that in Mr. Barton's case, his vote for this bill will result in 64,900 people from his congressional district in Texas losing health coverage and care. I now yield 2 minutes to the gentlewoman from California, Ms. Eshoo.
Gentlelady from California is recognized for 2 minutes.
I thank the gentleman. Mr. Speaker, The American people are very smart. They listen up, they kind of knit their eyebrows together, they listen to the debate, they want the facts, and then they make up their mind. And what our colleagues on the other side of the aisle have brought forward today is a disaster for the American people, and the American people know it. You have 17% of the American people that are for your plan. And the reason why, they know there are going to be higher costs. Families are going to have to pay more and get less. Pay more for their premiums, more for their deductibles, and more in their out-of-pocket costs. You're taking health care away from 24 million Americans. That's more than the entire population of Australia. Who comes to the Congress to hurt people? The promise of the Affordable Care Act was no one ever again will be able to take away your insurance, the way the insurance companies did 7+ years ago. Now, it's only the Republican Party that can take away the Americans' insurance. There isn't one developed country in the world that has your plan. It's a combination of all kinds of things to get votes. What free markets? What are you talking about? There's hypocrisy here because you all have the Affordable Care Act insurance. Every single member of Congress does. So I guess it's good enough for you, but it's not good enough for your constituents. This is a matter of life and death. You're playing with people's lives. It's a profound issue.
Gentlelady's time has expired.
This doesn't deserve
Gentlelady's time
one
has
vote
expired.
in the House of Representatives.
Gentlelady's
Vote it
time has
down.
expired. And the chair would remind all members to direct their debate to the chair. Gentleman from Oregon.
Thank you, Mr. Chairman. I yield myself 10 seconds before I yield to the gentleman from Michigan. I would just suggest that the American people are very smart. Unfortunately, under Obamacare, 19.2 million Americans said, I'm not going to buy Obamacare. I'm going to pay a penalty to the IRS instead. You see, we're trying to fix it so they'll want to buy it. I now recognize the gentleman from Michigan for a minute and a half, 2 minutes.
Gentleman from Michigan is recognized for 2 minutes.
Thank you, Mr. Speaker. You know, there's an old Upton family quote that my grandfather would always say, was you always perfect? No, none of us are. And you know what? This is not a perfect bill, that is for sure. But Obamacare is broken. 1 out of 3 counties has only one provider, and it looks like it's going to get worse as other major insurance companies are on the verge of pulling the plug. Nearly 24 of the nonprofit co-ops have already gone belly up. In my home state, folks saw their premiums increase by nearly 17%. Some states have had premium increases of more than 100%. Most had double-digit increases, many over 20%. And some forecast 40 to 50% increases come fall if nothing happens. The calls on both sides of the aisle have often used the R word. On this side, replace. On your side, the Democratic side, repair. Let's both agree the status quo is not acceptable. But this bill is the only train leaving the station. Is it going to improve if it gets to the Senate? Of course it will. We should all work for that goal. For me, I worked with Medicaid expansion states like Michigan, providing a reasonable transition until 2020, and then grandfathering all those folks until they're off. Some of my colleagues called to end Medicaid expansion even this year. They want total repeal. What would total repeal mean? Total repeal would mean taking away the ability of HHS to provide flexibility to the states to administer this critical program. It would mean taking away insurance for young kids on their parents' policies. It would reinstall a cap on insurance, and yes, it would allow insurance companies to discriminate against those with pre-existing illnesses. This bill still allows all of those important protections to stay in place, and a number of us will continue to work with HHS to provide even more flexibility to states like Michigan. This has to be a key component of moving forward. At the end of the day, I'd like to think that we can work together on a bipartisan basis. High premiums, lack of access impact us all. Let's work together. You can't get to second base unless you get to first.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Michigan that his vote for this bill will result in 43,500 people from his congressional district in Michigan losing health coverage and care. And now I'd like to yield 1 minute to the gentleman from New York, Mr. Engel.
Gentleman from New York is recognized for 1 minute.
Mr. Speaker, when people look at these bills, they want to know what they're going to pay. What this bill does is simple. You pay more and you get less. That's the bottom line. Pay more and get less. The president promised better health care for more people at a lesser cost, but my Republican colleagues can no longer claim with any credibility that their plan achieves these goals. 24 million people will lose coverage. People 50 to 64 will be hit with an age tax, pay premium 5 times higher than anybody else. Deductibles will go up, and protections to make sure insurance companies offer minimum value will be thrown out. Again, with the Republican bill, Trump Care, pay more, get less. But it gives billionaires a tax break. That's really, really important, isn't it? With the Affordable Care Act, we set out to give Americans more affordable, higher quality health care. Is the law perfect? No. We should be working together to tweak the law. We should be working together to improve the law, not putting in a clunker like this bill, which will roll back the time on people's coverage. Roll back the time, give people less coverage, and let them pay more. That's not what the American people want. I urge my colleagues to vote no.
Gentleman from Oregon.
Mr. Chair, right now recognize Chairman of the House Administration Committee, a very valuable member of our Energy and Commerce Committee, gentleman Mr. Harper, for 1.5 minutes.
Gentleman's recognized for 1.5 minutes.
Mr. Speaker, Obamacare has failed. Contrary to what was promised, premiums have gone up and there are fewer health insurance options. This bill addresses a crisis that before now had no end in sight. Not only does this bill work to solve the problems we see in the private insurance market, it addresses one of our nation's most vital programs, Medicaid. This program is a critical lifeline for hundreds of thousands of Mississippians. Medicaid is a safety net program that was designed for children, the elderly, pregnant mothers, and the disabled. This bill will refocus attention back on the program's initial goals, but will modernize it to better serve these patients. We should move decision-making authority down to those who are best positioned to address these problems. A program run primarily by the states with assistance from the federal government will best be able to help those that need it most. By giving states more tools to address costs, this bill will allow states to explore ways to make accepting Medicaid more attractive to providers, leading to better health outcomes. Without addressing the current problems facing the Medicaid program, it will not survive. This bill puts Medicaid on a path to sustainability. An insolvent safety net will harm those it intends to help. This is our moment. We have an historic opportunity to enact the biggest entitlement reform in our lifetime. We have a chance to save Medicaid. I urge my colleagues to vote for this bill, and with that, I yield back.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Mississippi that his vote for this bill will result in 69,600 people from his congressional district losing health coverage and care. And now I'd like to yield 2 minutes to the gentleman from Texas, the ranking member of the Health Subcommittee, Mr. Green.
Gentleman from Texas recognized for 2 minutes.
Thank you, Mr. Speaker. This is outrageous. Trump Care will rip health insurance from 24 million Americans, almost as many people that live in the state of Texas. Trump Care is a direct assault on the president's promise to the American people. It will saddle families across the country with massive health costs. It will lead to higher premiums, less benefit, and more people uninsured. Under this bill, premiums increase 15 to 20% in each of the next 2 years. It would particularly be terrible for the near elderly Americans because Trump Care allows insurance companies to charge them 5 times higher than what others would pay for coverage. It destroys protections for the Americans with the pre-existing conditions. It guts the essential benefits so consumers won't know what coverage they have. Plans will not have to cover things like emergency care, hospitalization, or even prescription drugs. What do you do when you leave people with that? Junk plans that insurance in name only. What is the point of having insurance if it doesn't cover anything? For those who aren't one of the 24 million who lose insurance, many will be left with plans that are more expensive, don't have the cover things like prescription drugs or mental health or substance abuse. The bill will make it harder for people to get treatment. It will destroy the Medicaid program, the bedrock of our social safety net that insures 74 million Americans, including children, pregnant women, and 1 in 7 seniors on Medicare. Trump Care harms Medicare. It will make the program insolvent 3 years earlier, directly causes Part B premiums to go up to by $8.7 billion, and it takes away funds that seniors depend on for long-term care. It's impossible to overstate how terrible Trump Care will be for American people. This is a dangerous bill. It's opposed by physician groups and hospital associations, and I urge my colleagues to vote no. And I'll be glad to yield my remainder few seconds to my colleague from Texas, Al Green.
The gentleman from New Jersey must yield the time. Yeah. And the gentleman's time has expired besides that.
I don't have any additional time.
Gentleman from Oregon.
Chair now recognizes the former head of our Medicaid task force, gentleman from Kentucky, Mr. Guthrie, for a minute and a half.
Gentleman's recognized for a minute and a half.
Thank you, Mr. Speaker. About 7 years ago, I was on the floor talking on the Affordable Care Act, and I remember talking about, I just left the state Senate, and bringing up that my colleagues are in Frankfurt and they're doing work on a budget, and in the future, it's going to make it more difficult for them to pass budgets because of the expansion in Medicaid, and that's coming to pass. It will be in the next budget session they have to deal with moving forward if we don't address this situation. So people keep talking about a rushed process. Over a year ago, we put together a Medicaid task force, met with groups of people, met with governors. We took a lot of information and put together a plan that addresses the needs of Medicaid. Medicaid is growing. It'll be over $1 trillion program within 10 years if we don't deal with it. It's going to implode. So we actually worked to put it on a sustainable budget. It's growing. People talk about cuts to Medicaid. Only in Washington, D.C., it's slowing the growth of a program, looked at it as a cut. So we've worked hard to move that forward. The other thing that I want to talk about, last year, small businesses were going to be hit by the minimum essential benefits. And small businesses were saying, we like our plans, we want to keep it, and we're going to have our prices go up, and we're not going to be able to afford to provide coverage. And so we all came together, bipartisan, to address that, to exempt the small business plans for those programs that passed by voice in the House, unanimous consent in the Senate, and signed by then President Obama. So the question is, if small businesses can design and keep their own plans, I think individuals can too. I agree with my friend from California that the American people are smart. I disagree with my other colleague, says they'll buy things they won't even know what's in it. So I urge, they are smart, and I urge the support for this bill.
From New Jersey.
Mr. Speaker, I remind my colleague from Kentucky that his vote for this bill will result in 44,000 people from his congressional district losing health coverage and care. And now I yield 2 minutes to the gentlewoman from Colorado, Ms. DeGette.
Gentlelady is recognized for 2 minutes.
Mr. Speaker, President Trump promised his health care plan would be, quote, much better health care at much lower cost. Secretary of Health and Human Services Tom Price even promised, quote, nobody will be worse off financially. In reality, of course, the Trump Care bill will leave just about everybody worse off with less care at a higher cost. This bad bill would rip health insurance money away from millions of people, 24 million over 10 years, and 14 million next year alone. Americans who are lucky enough to hold on to coverage if this bill becomes law will pay more for it in premiums, deductibles, and other out-of-pocket costs, especially people age 50 and up. Mr. Speaker, the deals that were cut last night to win more Republican votes for Trump Care would be even more devastating. Trips to the emergency room, mental health and substance abuse treatment, maternity care both before and after birth, prescription drugs, lab tests, and more essential services could be cut. Apparently, some people don't think these services deserve guaranteed health insurance. They would let insurers sell skimpy plans that don't even cover patients' basic needs. Democrats believe we can and should work together to improve the ACA, not to vote on a misguided bill that would gut it. We owe this to folks like Amanda Miller of Denver. Amanda changed jobs last year, and during her period of unemployment, she and her husband decided the smart thing to do was to get coverage to fill the gap. Thank God they did. Shortly after that, she and her husband got into a serious car accident. Amanda walked away unscathed, but her husband was badly injured. She could see more of his skull than she could see of his scalp. Luckily, there were some nurses in a car behind them, and they stabilized him and took him to the emergency room. Their hospital bill of $16,000 was paid in full thanks to Amanda's coverage through the ACA. What do we say to
Lady's time has
Amanda?
expired.
Can we guarantee her better insurance and a better financial situation? I
Gentlelady's
don't
time
think
has
so.
expired. Gentleman
Let's
from Oregon.
defeat this bill and let's start working towards a good one that will cover
Gentleman from Oregon.
everybody.
Thank you, Mr. Chairman. I now recognize the gentleman from Indiana, Dr. Bouchon, for a minute and a half.
Gentleman's recognized for a minute and a half.
Mr. Speaker, when Obamacare was debated 7 years ago, I wrote my member of Congress to urge him to vote against what I saw as a government takeover of our health care system. See, at that time, I was a practicing physician, and I could foresee the disastrous consequences of this law and what it would do to patients across this country, including my own. And I wasn't alone. Citizens from every corner of America stood up and demanded that Congress reject the Obamacare bill, but we were ignored. Since then, out-of-pocket costs for families have skyrocketed, patient choice has evaporated, and Obamacare has inched closer to the brink of collapse. In that time, those same Americans who fought against passage of Obamacare have delivered Republicans majorities in the House, the Senate, and put a Republican in the White House. They did so in part based on our promises to repeal and replace Obamacare. And here we stand, 7 years after Obamacare passed, with the opportunity to finally deliver on that promise and to bring relief to patients across this country who haven't been able to find the care they were promised at a cost they can afford. It's an opportunity for us to fulfill our promise to our constituents. Let's be clear, a vote against this bill today is a vote for preservation of the Obamacare disaster, a vote to keep critical health care decisions in the hands of bureaucrats in Washington, D.C., and a vote against the largest entitlement reform in a generation. I urge all of my colleagues to do the right thing and vote for this bill, and I yield back.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Indiana that his vote for this bill will result in 37,800 people from his congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from Pennsylvania, Mr. Doyle.
Gentleman from Pennsylvania is recognized for 1 minute.
7.5 years, Republicans have promised Americans something better than the ACA. Instead, today, they're giving us something much, much worse. 24 million people lose their insurance, stripping away guaranteed benefits, putting maternity, mental health, and pediatric care at risk. Shame on you. Pitting the elderly against children, the disabled, and the mentally ill in the Medicaid program, placing a tax penalty on veterans, charging a crushing age tax on 50 to 64-year-olds, forcing them to pay 5 times more than what others pay. Shame on you. This isn't a health care bill. This is a tax cut bill masquerading as a health care bill. This bill does nothing to lower premiums, copays, or deductibles. You cut taxes by almost $1 trillion for corporations and the rich while ransacking Medicaid and the Medicare Trust Fund. That is shameful. Americans will not forget who did this to them today.
Time has expired. Gentleman from Oregon.
Thank you, Mr. Chairman. Now recognize a real leader on our committee, the gentleman from Texas, Mr. Bill Flores.
For
a minute and a half, sir.
Gentleman's recognized for a minute and a half.
Mr. Speaker, we've heard numerous comments from the left extolling the virtues of Obamacare, and I think it's instructive to hear the words of a former Democrat president that is beloved by the left. Here's what he said less than 6 months ago. So you've got this crazy system where all of a sudden 25 million more people have health care. Then the people that are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world. Mr. Speaker, hardworking American families in my district, they don't want crazy. They want the American Health Care Act, a sane plan that gives them their freedom back. In a few minutes, Mr. Speaker, you're going to hear somebody from the other side say that a bunch of my constituents are going to lose coverage. That is absolutely false. Those constituents are getting their freedom back to choose whether or not they want health care coverage and what kind of health care coverage they want. I say vote yes. Thank you, Mr. Speaker. I yield back.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Texas that his vote for this bill will result in 61,900 people from his congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from North Carolina, Mr. Butterfield.
Gentleman from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, over the last few days, 110 organizations have written to me in opposition to Trump Care. You know who they are? AARP, American Hospital Association, American Heart Association, American Medical Association, American Academy of Physicians, American Academy of Pediatrics, American Psychiatric Association, National Association of School Nurses, Alliance for Retired Americans, American Federation of Teachers, National Association of School Psychologists, National School Boards Association, National Education Association, the Children's Defense Fund, March of Dimes, the National Committee to Preserve Social Security and Medicaid, the American College of Physicians in North Carolina, North Carolina Society of Addiction Medicine, Consumers Union, United Steelworkers, AFL-CIO, Families USA, Centers for American Progress, National Association of Pediatric Nurse Practitioners, and the list goes on and on and on. I ask unanimous consent that this entire list be included in the record. What is it about this, Mr. Speaker, that you don't understand?
Without
You are
objection.
wrong on this. Don't let your base push you over the cliff on this bill. I yield back.
Without objection, the gentleman's request will happen. Gentleman from Oregon.
Thank you, Mr. Speaker. I now recognize the gentlelady from Indiana, Ms. Brooks, for a minute and a half.
Gentlelady from Indiana is recognized for a minute and a half.
Thank you, Mr. Speaker. I appreciate the passion I've heard from colleagues on both sides of the aisle and from Hoosiers on all sides of this issue. The issue of health care is personal for people, and it should be. But today, health care isn't personal. Under Obamacare, health care coverage has been a one-size-fits-all approach. I've heard from so many of my constituents in my more than 4 years in Congress about how Obamacare has cost them and their families lost doctors, higher premiums and deductibles, and a lack of options for coverage. As an example of just one of those Hoosiers, Lon told me his premiums and deductibles doubled last year when he lost his health care plan. He's had to change his insurance 3 times in 3 years. That is not how health care coverage should work. The American Health Care Act makes health care coverage more personal for every American. This bill empowers you and every American to choose the best health care for you and your family. It empowers our governors and our state legislatures to meet the individual health care needs of our citizens, including the people struggling to make ends meet and the most vulnerable, the elderly, pregnant moms, kids, and people with disabilities. I applaud our Hoosier Governor Holcomb, who led a letter to Congress with other governors from around the country who support this bill. He too believes it's in the best interest of Hoosiers. I agree, and I urge my colleagues to join me in support of the American Health Care Act. Thank you. I yield back.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Indiana that her vote for this bill will result in 37,700 people from her congressional district losing health coverage and care. And now I yield 2 minutes to the gentlewoman from Florida, the vice-ranking member of our committee, Ms. Castor.
Gentlelady from Florida is recognized for 2 minutes.
Thank you, Mr. Speaker. Mr. Speaker, my neighbors back home in Florida work very hard for their health coverage. When they pay their hard-earned co-payments and premiums, they expect something meaningful in return, real health care. And that's what the Affordable Care Act provided. Not just a piece of paper, but real health services. And an end to discrimination against pre-existing conditions and all sorts of other consumer protections. But in the middle of the night last night, the Republicans turned back the clock. They have eliminated from the basic health insurance policy coverage for emergency room visits, hospitalization, prescription drugs, and more. They've really embraced the moniker of pay more for less. And on top of it, remember, this bill rips health insurance away from millions of our neighbors back home. It raises costs on hardworking Americans, especially our older neighbors. It's practically an age tax if you're over 50 years old. It breaks that fundamental guarantee that has existed for 50 years that if your family is struck with an Alzheimer's diagnosis, a child with a complex condition, a handicap, that you're not going to live your remaining years in poverty. All the while, taking your tax dollars and shifting it to millionaires and billionaires and corporations. Trump Care is a recipe for disaster. It is a fundamental violation of the values we share as Americans, and it should meet its demise today. I yield back the balance of my time.
Gentleman from Oregon.
Mr. Speaker, I now recognize a real leader on our committee, the gentleman from New York, Mr. Collins, for a minute and a
New
half.
York's recognized for how long?
Minute and a half, sir.
For a minute and a half.
Thank you, Mr. Speaker. Today is a historic day. Make no mistake about it. The American Health Care Act changes the trajectory of health policy in this country. And here are just a few of the highlights. This bill eliminates the individual mandate penalty, eliminates the employer mandate penalty, eliminates the Obamacare subsidies in 2020, eliminates Obamacare tax increases, eliminates insurance mandates so we can lower premiums, provides refundable tax credits for individuals and families who do not get their health insurance through their employer or the government to choose the health care that works for them, almost doubles the contribution limits for health savings accounts, provides $115 billion for Patient and State Stability Fund to lower patient costs and stabilize the insurance market, and enacts the most significant reforms to Medicaid in history, ensuring that Medicaid is sustainable and available for the most vulnerable among us for generations to come. The American Health Care Act is a monumental step towards freedom, choice, and individual responsibility in health care. I will proudly vote for this bill today, and I urge all of my colleagues to do the same. I yield back.
Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from New York that his vote for this bill will result in 58,000 people from his congressional district losing health care coverage and care. And now I yield 1 minute to the gentleman from Maryland, Mr. Sarbanes.
Gentleman from Maryland is recognized for 1 minute.
Thank you, Mr. Speaker. This is a terrible bill. It's a terrible bill. It's wrong for the country. Why would the president, why would the leadership on the Republican side here in Congress, why would they choose as the first order of business taking health care coverage away from 24 million Americans? It's wrong-headed, it's immoral, it's inhumane, it makes no sense. It's wrong for America. In the people's house, we need to vote it down. I yield back.
Gentleman from Oregon.
Thank you, Mr. Speaker. I now recognize the gentleman from Michigan, Mr. Wahlberg, for a minute and a half.
Gentleman's recognized for a minute and a half.
Mr. Speaker, for 7 years, I've heard story after story from people in my district about the Affordable Care Act, that it is anything but affordable. Families and small businesses are paying more for less, and insurers are dropping out of the marketplaces, leaving behind fewer options. Government-run health care isn't working, and we are appealing and replacing Obamacare like we promised our constituents we would do. The American Health Care Act is the first step of a three-step process to repair our broken health care system. This bill moves power away from Washington and puts doctors and patients at the center of their health care decisions. It reforms and strengthens Medicaid and gives states the flexibility to innovate and best meets the needs of their citizens. This patient-centered approach will bring costs down, increase choice and competition, and provide important protections for patients with pre-existing conditions. Mr. Speaker, these are types of things we promised, and doing nothing is not an option. And may I remind my colleague from the other side of the aisle, I've seen those numbers. My constituents will not simply walk away and do nothing just because the other side says that they'll be uncovered. Now they will have a choice. Those thousands of people will not walk away. They will choose something better for them. There will be thousands of people that have insurance that covers their needs and not what Mr. Speaker, my colleague says they will do.
Gentleman's time
They're
has
not
expired.
that stupid. They won't walk away.
Gentleman
I
from New
yield back.
Jersey.
Mr. Speaker, I remind my colleague from Michigan that his vote for this bill will result in 39,500 people from his congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from California, Mr. McNerney.
Gentleman's recognized for 1 minute.
Mr. Speaker, since the implementation of the ACA, over 3.9 million women aged 18 to 64 have gained health care coverage through Medicaid. The ACA ended gender rating, meaning that the insurance companies cannot charge women more than they charge men for the same coverage. Trump Care also eliminates Medicaid funding for Planned Parenthood, reducing access to health care for women. Millions of women rely on Planned Parenthood for both routine and life-saving care, such as preventative services, family planning, and preventing unwanted pregnancies. When the GOP strips Planned Parenthood funding, health care of women will suffer. Trump Care and its Medicare cuts also hurt seniors. Older Americans account for over 60% of Medicare spending. Insurance companies will now be able to charge more based on their age, which will increase premiums by thousands. Mr. Speaker, watching Republicans sell this bill is like buying a used car from a guy with a crooked smile. Even they don't believe in it. I ask my Republican colleagues to withdraw this horrible bill and work with Democrats to improve the ACA instead of trying to sell this atrocity.
Gentleman from Oregon.
Thank you, Mr. Speaker. Mr. Speaker, I now recognize our resident pharmacist on the committee, gentleman from Georgia, Mr. Carter, for 1.5 minutes.
Gentleman's recognized for 1.5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I am joyous to be here today on such a historical day. You see, for the past 7 years, I've practiced in Obamacare. I've practiced under Obamacare. I've practiced in that setting, and I can tell you, what it promised, it has not delivered on. There has not been increased accessibility. No, instead of that, we've got 5 states in our country that only have one plan to offer. We have a third of the counties in our country that only have one plan to offer. We have 16 counties in Tennessee that don't even have a plan. And now we're going to have the opportunity to have access. Now we're going to have choice. We've also been told about affordability. Well, let's talk about affordability. We see what Obamacare did. It increased premiums 25% this year alone, 50% in 7 states. That is unsustainable. What is our plan going to do? It's going to give affordability. It's going to give competition. We're going to have choices. And what else? It's going to remove red tape. It's going to remove the barriers between healthcare professionals and patients. It's going to empower patients. That's what healthcare in America is about people making healthcare decisions with their healthcare practitioners. That's what we're going to do. That's what this does. The 2 worst things that Obamacare did to the healthcare system in America, first of all, it took the free market out of America. It took the free market out of healthcare in America. It also expanded Medicaid, a safety net program that was intended for the aged, the blind, disabled, for children and mothers, and extended it to able-bodied adults, something that it was never intended to do. Mr. Chairman, I look forward to hearing how many people in my district are going to be empowered now from the gentleman from New Jersey.
Gentleman's time has expired. Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Georgia that his vote for this bill will result in 62,800 people from his congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from Vermont, Mr. Welch.
Thank you, Mr. Recognized for 1 minute.
Mr. Speaker, those of us who support the Affordable Care Act know that the work of improving health care, making it more affordable and accessible, that work is never done. It matters. It really matters to the mothers and fathers we represent and to the children that they love. But this bill, stripping 24 million of Americans of health care, is Linda from Burlington. She left an abusive marriage, but had to leave her health care behind. The Affordable Care Act rescued her, and she's gone on to revive her life and her future. And our community hospitals that do so much good in all our communities have gone from red ink to black ink by the help that the Medicaid expansion provided. But you know, it's a sad day for this institution. We did all this without hearing from a single patient, a single doctor, a single person. We had no hearings. Mr. Speaker, can't we do better than that? I yield back.
Gentleman from Oregon.
I now recognize the chairman of the Education Workforce Committee, the gentlelady from North Carolina, Ms. Fox, for 2 minutes.
Gentlelady from North Carolina is recognized for 2 minutes.
Thank you, Mr. Speaker, and thank you, Mr. Walden. Thank you. Skyrocketing costs, diminished choices for patients, small businesses destroyed, fewer jobs and lower wages. That's Obamacare's legacy. That's what Democrats imposed on our country. We believe the American people deserve a better way, and that is what this legislation will deliver. The American Health Care Act puts the American people back in control of their health care. It restores choices, protects the most vulnerable, encourages lower health care costs, empowers states, and frees families and small businesses from costly taxes and mandates. Let's keep our promise to provide a better way on health care by voting yes on the American Health Care Act. Mr. Speaker, before I yield back, I asked my friend and colleague, Mr. Walden, to engage in a brief colloquy. Thank you. Health sharing ministries play an increasingly important role in the lives of many Americans, particularly in the devastating wake of Obamacare. In recent days, constituents have expressed concerns about the future of these health care plans, particularly as it relates to whether they would be considered credible coverage under the bill's continuous coverage provisions. Will the chairman work with me as the bill moves forward to ensure we address the concerns of those who benefit from health sharing ministries? I yield to the chairman.
I'd be delighted to work with you. Healthcare sharing ministries are a vital part of our healthcare system. They're a shining example of how communities can come together without government mandates or dictates to provide innovative healthcare solutions. I look forward to working with you on these concerns that you've raised, and we'll work with the Senate to get repeal and replacement of Obamacare to the President's desk.
Thank you, Mr. Speaker. I yield back.
Gentlelady is back. Gentleman from Oregon Reserve. Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from North Carolina that her vote for this bill will result in 80,600 people from her congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from New Mexico, Mr. Lujan.
Gentleman from New Mexico is recognized for 1 minute.
My Republican colleagues have called Trump Care everything from an act of mercy to a rescue mission. Now, I might live at the end of a long dirt road, but I didn't fall off the turnip truck yesterday, and neither did the American people. Congressional Republicans are jamming their catastrophic bill that will take health insurance away from 24 million Americans. Raise your premiums, raise your deductibles, raise your out-of-pocket costs, and will slap a crushing age tax on those over the age of 50. Republicans in Congress promised they would lower costs, but this mess raises costs on families. Not only does the CBO tell us premiums will increase 15 to 20%, but Trump Care will allow insurance companies to increase deductibles and out-of-pocket costs. Under the guise of state flexibility, Republicans say they are shifting responsibility to states. Here's what that means. Trump Care will force states to raise taxes and ration care. It will repeal the requirement for insurance plans to cover doctor's visits, emergency room care, prescription drug coverage, and even mental health services. Everyone is entitled to their own opinions, but not their own facts. The fact is, Trump Care will raise your premiums, raise your deductibles, and hurt millions of hardworking families. I urge my colleagues to vote no.
Gentleman's time has expired. Gentleman from New Jersey Reserve. Gentleman from Oregon.
I thank the Speaker. Now I'm delighted to recognize the gentleman from Pennsylvania, Dr. Murphy, our resident psychologist who does a remarkable job on mental health care issues and all of these health care issues. 2 minutes.
Gentleman from Pennsylvania is recognized for 2 minutes.
I thank the gentleman and thank the Speaker. In my district, over the time span since the Affordable Care Act Obamacare was passed, I have fielded many a call from a person who said they could not afford health care. In some of those instances, even though a person was able to afford the premium, they could not afford the deductible. One man, age 55, he and his wife said that they would have to pay something like $27,000 out of pocket between premium, deductibles, and copays before they could use their first. He was one of the 19.2 million Americans who chose to pay the fine rather than get on the Affordable Care Act Obamacare. And we suspect that many more will continue on with saying, I'd rather pay a fine or find a way out rather than continue to pay for it if this continues on as is. In the past, we should say we've been battling many things
under this with regard to mental health care. Past administration attempted to strip the protected drug class status for life-saving psychiatric medications. We fought back on that. We also worked together, however, in a bipartisan way to make sure we had assured things for mental health care. This bill has several provisions which are extremely important. $100 billion, which states may use to help in their stabilization fund to fund mental health care. Another $15 billion focused on mental health care. $500 million for substance abuse. Funding will be in there. My hope is the states make a decision. It is in their hands with the passage of this bill that they can make the right choice to continue mental health care, and I trust they will do that. And with that, I yield back.
Gentleman yields back. Gentleman from Oregon Reserve. Gentleman from New Jersey.
Mr. Speaker, I remind my colleague from Pennsylvania that his vote for this bill will result in 37,100 people from his congressional district losing health coverage and care. And now I yield 1 minute to the gentleman from New York, Mr. Tonko.
Gentleman from New York is recognized for 1 minute.
Mr. Speaker, a resounding no to Trump Care, President Trump's broken promise to our great America. There is no disputing the devastation this bill will cause for America's working families. Trump Care will rip health insurance away from 24 million people. It will raise costs for consumers and lower standards of care, with premiums rising and deductibles increasing by an average of $1,500. Trump Care will eliminate required mental health and addiction benefits, jeopardizing recovery for millions of Americans in the midst of this opioid epidemic. It imposes a crushing new age tax on seniors and those approaching retirement, amounting to tens of thousands of dollars. Trump Care steals from Medicare, and it cuts Medicaid by $839 billion, mercilessly putting children, the elderly, the disabled, and our most vulnerable at risk. And it does all this to give a $1 trillion tax cut to millionaires and billionaires and corporations. The American people overwhelmingly reject this bill. Defeat Trump Care, vote no. I yield back.
Gentleman's time has expired. Gentleman from New Jersey reserves. Gentleman from Oregon.
Gentlemen, I reserve balance of my
Gentleman from
time.
Oregon reserves. Gentleman from New Jersey.
Mr. Speaker, I would yield now 1 minute to the gentlewoman from New York, Ms. Clark.
The gentleman from New York is recognized for 1 minute.
Mr. Speaker, I rise today in strong opposition to this sham American Health Care Act. I'm from Brooklyn, and in Brooklyn we know men lie, women lie, the numbers don't. And here are the numbers. This reckless and destructive bill leaves 24 million Americans without coverage. It will cause the uninsured rate for my district to skyrocket over 12% and leave over 400,000 Brooklynites without coverage. Because of age discrimination in this bill, the age tax, it will put our seniors in the terrible position of having to choose between eating, visiting their doctors, or purchasing medication. Which one do you, Mr. Speaker, suggest they choose? I also vehemently oppose the Empire State kickback language put in this bill as an attempt to get Republican votes. This language is a dressed-up earmark that specifically targets New York City. It targets my home. This would further reduce Medicaid funds for New York by an additional $2 billion. The trade-off, raising city taxes to cover the gap.
Gentlelady's time is
Speaker, I yield back.
Gentlelady's time is expired. The gentleman from New Jersey reserves. Gentleman from Oregon reserves. Gentleman from New Jersey.
Mr. Speaker, may I inquire how much time remains on either side?
You certainly may. Gentleman from New Jersey has 68 minutes. The gentleman from Oregon has 65 1/2. The gentleman from New Jersey is recognized.
68. What did you say?
1 hour and 8 minutes. 68 minutes.
No. All right, I'll yield 1 minute, Mr. Speaker, to the gentleman from Iowa, Mr. Loebsack.
Gentleman from Iowa is recognized for 1 minute. Gentleman from Iowa will suspend. Does the gentleman from Oregon have? Gentleman from Iowa is recognized.
Mr. Speaker, I am disheartened by what Congress is doing here today. My #1 goal has always been to ensure Iowans have access to quality, affordable care. This legislation does not do that. It implements an age tax, raising costs on older Americans. It cuts nearly $900 billion from the elderly, nursing homes, and disabled children. This is unacceptable. Exactly those who need health coverage the most, middle-class families, people with disabilities, and those who are less fortunate are the ones who lose out in this Republican bill. I remain committed to working to improve health care coverage so it works better for Iowans and all Americans. We cannot go back to a time when Iowa families had to choose between putting food on the table and getting medical care for their children. Unfortunately, that is just what this bill does. I urge my colleagues to vote this bill down, and I yield back.
Gentleman yields back. Gentleman from New Jersey reserves. The gentleman from Oregon.
Well, yeah, if I could get an indication, Mr. Chairman, in terms of, or Mr. Speaker, in terms of the amount we are down on each side here. I think we were allocated a half an hour.
Gentleman referring to the time of committee time.
Yes.
Hold. The gentleman from Oregon has 9.5 minutes left in the Energy and Commerce portion of this debate.
And the minority side? Or is that what's left split equal?
Oregon will suspend. The chair has not allocated the time by committee to the minority time.
Okay.
4 hours of general debate.
Could we just ask the total, because then maybe we can figure it out on the minority side?
The gentleman from New Jersey, I just gave the total time just a few moments ago when I had to repeat, so that is the total time we're working back off of. We will connect. We have 9.5 minutes left in the Energy and Commerce time. It was just stated.
Well,
67 minutes from the gentleman from New Jersey for minority. 7.
All right, I'll continue to.
After all these late nights and backroom deals, here we are. This version of the bill was just dropped on our lap this morning.